Hi, my name is Michelle, and today we're going to be doing the musculoskeletal system with my fiance, Hannah Ross. I already did consent with her, but let's do it on camera. Is it okay if I record you and upload this video to YouTube for United States University, and so that my instructor can grade you?
Yes.
Okay. All right. Oh, I thought the vacuum was going to start. Okay, so anyways, we're gonna do an integrity check around. This is the living room. We're gonna go past, we're gonna go through the whole entire kitchen. And then the floor, I can't see anything in over here anyways. And then the ceiling. And then here, we're back, the door's closed. It's all around with the couch and everything. And then can you hop down so we can see behind you, just in case? Make sure I say that again. There's no notes or anything behind her. And there's this underneath the table. Then here, pillows are up. Those are just for comfort. Sanitizer here. Nothing else. Behind me, nothing. Nothing's on the table. There's no papers, no nothing. Okay. All right. Okay. So then we're going to come back and sit. I'll put that back just a tad bit. All right. So tell me your first and last name. And your date of birth.
529.
All right. What are we doing here?
Musculoskeletal.
All right, cool. All right, so first thing I'm going to do is start by inspecting the hands. So can you place your hands out to your side? Beautiful. So I'll start by inspecting the hands. And when I'm inspecting the hands, I'm looking for any type of asymmetry, atrophy. I'm looking for any type of deformities, discoloration. I'm looking for any type of nodules, redness, and or swelling. I don't see any of that here bilaterally on both sides. And then now I'm going to palpate. So when I'm palpating, I'm going to start at the dips, and I do in immersion. We were all told that we can do abbreviations. So the distal interphalangeal joint. I always get tongue tied with these. So I do the dip, the pips, and the metatarsals on each on each joint, each finger. The dip, the pips, and the metatarsals. And I'm feeling for any type of crepitus. I'm feeling for any type of tenderness, any swelling, any nodules, any heat. I'm feeling for any fluid. The CT, this is my acronym, CT. So crepitus, tenderness, F, fluid, H for heat, S for swelling, and then nodules. Everything is in, I don't notice any of those. And bilaterally, it is normal. So now we're going to start with the abduction of your hands. So we're going to start with the range of motion. We did the inspection, we did the palpation, and then now we're going to do the range of motion. So start by abducting your hands away from your body. Beautiful. Adducting into the body. Beautiful. Flexing down towards the floor and extending up towards the ceiling. Beautiful. And then you're going to bring your palms back to center. Beautiful job. And she has full range of motion with no expressions of pain. And then, so go ahead and put your hands back down. And then from the fingers, we're going to move on to the metatarsals, or excuse me, we're going to move on to the wrists. And before I touch the wrist, I'm going to do the same type of inspection. I'm looking for asymmetry, atrophy. I'm looking for discoloration, any type of discoloration, any type of deformities, any in nodules, R for redness, S for swelling. And I don't see any of those bilaterally on both sides. So now I'm going to go in and palpate. I'm going to be palpating the metatarsals and the metatarsals and the tarsals and the metatarsals and the metatarsals and the wrist bone here on the lateral side and the medial side. And what I'm feeling for is any type of crepitus, any tenderness, feeling for any type of nodules, feeling for any type of fluid, any heat, any swelling, or anything along those lines. I don't see anything like that. And then I don't feel anything like that, rather. And then we'll move on to the range of motion of the wrist. So first I'll extend your hand out. I'm going to extend your hand out and extend your hand out towards me. Yeah, so we're going to do the wrist. So come here. Beautiful. And then you're going to flex the wrist down, and then you're going to extend the wrist up, and you're going to bring your palms up like this. And then you're going to invert on this is the invert on the ulna side, evert on the radial side. So the radial nerve, and then invert on the ulna nerve. Come back to center. Beautiful. There's no tenderness or pain with that range of motion, and it is normal bilaterally. Okay, flip your palms over. And then from the wrist, we're going to move up to the elbows. We're going to do the lateral epicondyle. Oh, shoot, I'm not going to touch it. So before I touch, I'm going to do an inspection, because you always want to inspect before you touch. So before I touch the elbows, we're going to inspect. And what we're inspecting for is asymmetry. We're inspecting for atrophy, discoloration, deformity, any types of nodules, redness, swelling, DNRS, yes, or anything like that. I don't see any of this bilaterally, so I'm going to move on. And then I'm going to start by palpating. I'm going to palpate on the lateral sides of the epicondyle, the medial sides of the epicondyle as well, and then the lateral, and then the medial superficial of the ulna, or something like that. Superficial ulna, or it's like the medial part of the ulna. I'll come back with that word. It's similar to superficial, but it's not. That's not the word I'm looking for. Whatever. But this is the medial side of the ulna. And then what I'm palpating for is any type of crepitus, tenderness, CT, FHS, so fluid, heat, or any type of swelling or any type of nodules. When I'm coming here is when I'm, can you rotate out, feeling here. I don't feel any of that. It is normal, no type of tenderness and no type of pain, correct?
Correct.
All right. And then, so I'm done with that part. Now we'll move into a range of motion. So for the range of motion, like I'll demonstrate throughout this whole process. I'll demonstrate, and then you just return demonstration towards me, okay? And let me know if anything is uncomfortable, okay? Or if I'm going too fast, okay? All right, so then I'll have you flex your hands in. This is for the elbow, and then extend out. Beautiful. This is also pronation, and then flip over for supination, okay? And then that's testing the range of motion, and bring your palms down to your side, and that would be the elbows, okay? And then next I'm gonna move up to the shoulders. And for the shoulders, I'm going to start with inspection. The special part of this inspection is going to me making sure is that I make sure that the shoulders are symmetrical. I'm not going to touch because I'm inspecting. So the shoulders are symmetrical. One's not higher than the other. And then I'm inspecting for asymmetry, atrophy, deformity, discoloration, nodules, redness, swelling, or anything along those lines. And when I'm done with that part, so then we'll move on to palpate. And when I'm palpating, I'm coming up the arms, up the sides of the deltoids, and I'm feeling for any type of crepitus, any type of tenderness. Do you feel any tenderness or anything like that? And then and we're feeling for any type of fluid, any heat, any redness, or no, not feeling for redness, any nodules, any swelling. I'm gonna make my way all the way up here, any type of pain or anything when I touch here. And then I'm gonna start here. Okay, so I first wanted to say that in clinic, my patient would be in a gown, so you can see all of these joints and you can see the skin as well when we get there. But because of the video going on YouTube, she's gonna stay with her clothes on. I mean, unless you, no, I'm just kidding. So have your clothes on, and then no gown. So, but in the clinic, we would obviously be in a gown for this entire process. So I'm going to start with palpation. I'm going to start here at the sternal notch, and I'm going to be palpating here all the way along the supraclavicular line. And I'm still palpating for the crepitus, any tenderness, any type of fluid, any nodules, any swelling, or heat or warmth. I'm coming all the way out to the ACP area into the ICP area. And you'll note here when you're in the ICP area, can you leave your hands down? And you can flex the arm up, and you can feel it in the process as it comes up and goes back down in the ICP. And then this is bilaterally. I'm going to make my way around to the subdeltoids in the back, and then come back to the, can you sit up tall? And come back to the bicep grooves here, the bicep grooves. And when I come to the bicep grooves, I'm going to note here in the tibius humerus, which is where you will feel if you externally rotate the humerus out and internally rotate it back in, the tibius humerus. I don't know any type of pain or tenderness. It is symmetrical and bilateral. Both sides are normal findings all throughout. Okay, that's the shoulders, and then we'll move on to the head and neck. So for the head and neck, I'm going to be visually inspecting the skin, the cranium, obviously the neck and the whole head, but I'm going to be inspecting anteriorly, laterally, posteriorly, all the way around the whole circumference of her head. I'm just trying to stay in the view of the camera. I don't want to go all the way, and I can't walk through the table. So I'm going to inspect that, and I don't note any type of asymmetry. The shoulders are symmetrical on both sides, as you saw earlier, and I don't notice any asymmetry, any atrophy. There's no deformity, discoloration. There's no nodules. There's no redness. There's no swelling that I can visually see. And we're on the head and neck. And then I'm going to go in to palpate. So when I start to palpate, I'm going to come here at the cervical. I'm going to go to the cervical spine, your cervical process here. I'm going to come down to the cervical clavicular line, or the cervical, like the cervical process, and then bilateral, or excuse me, I'm going to come around to the back and go down the cervical spine down. Note for any type of tenderness or anything like that. Is there any tenderness or anything like that? No. And then I'll come back to the cranium and the head, and I'll start here in the TMJ, and then I'll have you open your mouth. Beautiful. Move side to side, left, right, and then close your mouth. Cranial nerve 5, open your jaw. Beautiful jaw strength. Bilaterally, there's symmetry, there is no asymmetry. And then here, there's another test where we're going to skip this one, but she could use 3 fingers and put them in, open her mouth and place them in her mouth. And we'll save that for clinic, not for here. Okay. And then the next thing is, so I start the palpation, and I'm feeling for any nodules. I'm feeling for any crepitus, any tenderness, any nodules, any CTF, any fluid, any heat, any swelling, and I think that's it. The nodules, I said nodules. So I'm feeling this all throughout, and we're on head and neck, okay? And then, so we're gonna do a test here called the Sperling's test. I forgot a test back here. I'll do that after this. I forgot a test on your wrist. Okay, and then the Sperling's test is where I'll have you extend your neck back and laterally rotate to one side. And then I would put pressure here, checking for cervical pressure. Any pressure would I push down? No. The cervical, come back to center. Cervical pressure pain would be a positive sign for that, and it is not. And then that's the head and neck. And then I'm going to finish, I'm just going to go ahead and finish the range of motion of the neck. I'm going to have you turn laterally one side, come back to center, turn the other side, come back to center, and I'll have you flex down, chin to chest, and extend all the way up, looking at the ceiling. Beautiful. Come back to center and bring your one elbow to your shoulder, your choice. I'm sorry, one ear to your shoulder, your choice. Come back to center, and then the next ear to shoulder. Come back to center. Any type of pain or tenderness, no crepitus or pain or tenderness or anything like that. And then I would like to go back, because here with the wrist, if you flip them over, you can do what's called the carpal tunnel test and the phalanx test. The carpal tunnel test is where you're going to use the third digit of your finger, and you're going to press along here on the medial line, the medial nerve, looking for any pain bilaterally, any pain or discomfort or paresthesia, and there is none. The next test is going to be the phalanx test, where you bring the back of your palms together and you're going to push and hold for about 45 seconds and see if there's any pain, numbness, or discomfort. There is none. Okay. All right. So thank you. I forgot those. And then, so that was the head and neck. I'm just giving a minute to see if I'm getting everything with the head and the neck. Don't notice anything with the eyes, the ears and mouth. We did the test, that test we did, the Sperling's test we did. And then, okay, so that was the head and neck. I would move to the spine, but I forgot the shoulder, the shoulder range of motion. So for the shoulder range of motion, I'll have you stand up. Let's move this. Oh, okay, beautiful. So I'll stay in the line of the camera. Okay, so for the shoulder, range of motion, what I'll have you do is, no, you're gonna face the camera. Yeah, right there. Just face forward. I'm just showing you. And you can just listen to me, really, if you just want to look ahead, that's fine. So for the shoulder range of motion, the first thing I'll have you do is flex your arms up like a mountain pose. All right, beautiful. Relax your shoulders down. Exhale, extend your arms back behind you as far as you can. This one's 60 degrees. The first one was 180 degrees. And then you're going to come out, abduct your arms away from your body, and then adduct towards your body. Abduct like towards your sides. Beautiful. Abduct in. And then you're going to internally rotate with your palms back behind with the palms back behind. Yep. And then you're going to externally rotate your palms up. Beautiful. And then you're going to bring one hand down to your side and one arm out. And this is going to be the drop test. So if she had a rotator cuff injury, it would just drop down when I tell her, slowly bring your arm back down, adduction towards your body. And if it were to just drop, that would be a positive sign for the drop test. Beautiful. Nice. And that takes care of the range of motion for the shoulder. I would also like to note that I'm feeling the cervical. Okay, I'll have you actually turn for the camera right there. I'm going down the cervical spine and then the cervical process, feeling for the trapezoids and the rhomboids here. There's no tenderness and no pain. I forgot this part with the palpation. There's no crepitus, there's no tenderness, there's no heat, no fluid, no nodules, and no swelling noted. Any type of pain or anything like that? All right, beautiful. And then we're gonna move on to, so we did the head, the shoulders, head, the shoulders. We did the range of motion with the shoulders, and then we're gonna move to the spine. And then down, so before we touch the spine, I'm going to go ahead and inspect the spine. I noticed that she is in an upright position. Her spine is straight and it is in alignment. Her shoulders are in alignment with her hips. And I also noticed that she doesn't have any flat-footedness or anything like that. She looks very good. The glutes are in alignment, which obviously in a gown you would be able to see this. Her skin, there's no discoloration in the skin. There's no asymmetry, there's no atrophy, there's no discoloration or deformity in the spine, no kyphosis or scoliosis or lordosis or anything like that. There's also no nodules, no swelling or redness that I can see. And then when I go in to palpate the spine, down the spine, I'm palpating for any crepitus, any tenderness, any type of fluid in the intervertebral spaces, intervertebral process, and into the intercostal muscles. So I'm feeling for any tenderness. I'm sorry, let me go down. I'm palpating for any type of crepitus, tenderness, CTF, fluid, heat, nodules, or swelling. And I don't notice anything like that. Also notice that is one straight line. This is the normal curvature of the spine. Okay. And then I want to do, I believe we need to do the range of motion for the spine. Okay. Then I'll have you turn this way towards me and then turn again for the camera, like towards the door. Beautiful. And so leave your hands by your side. Thank you. And then, so I'm sorry. And then sit still. And then for the, for the range of motion test, I'll have you move this bench. So for the range of motion, bend your back, or I'll bring the camera back. So for the range of motion, I'll have you go ahead and we're going to do like a yoga pose because I teach yoga too. So it's going to be like flex all the way forward and come into a halfway lift. So bring your palm position just for comfort. So during the flexing forward, like bring your palms to your thighs. That'll be better. There. Oh, beautiful. Yes. So what you're going to notice here is I'm going to inspect for all of those things. I'm inspecting for atrophy, asymmetry. I'm inspecting for the AADNR, the discoloration, any deformity. I'm doing nodules, redness, swelling, anything like that. And then I'm also going to palpate here is a normal curvature of the spine. There's no kyphosis or scoliosis here. The spine is nice and straight with the crown of the head reaching forward. The shoulders are in alignment down with the hips are in alignment along with the glutes. And I palpate. So this is a normal finding. And I'll have you go ahead and lift back up. Beautiful. There's normal curvature of the spine. The shoulders are symmetrical. The hips are symmetrical. The iliac crest is symmetrical. The glutes are symmetrical as well. And then I'll have you go ahead and extend back towards me. So do like a back bend with no arms. Yes. And shift your hips forward. Beautiful. Normal curvature of the spine here. The shoulders stay symmetrical along with the hips and the iliac crest. And there's no asymmetry in the glutes as well. Go ahead and lean back up. Beautiful. So here again, I notice that there's normal curvature of the spine. It is straight. There's no kyphosis, scoliosis, or lordosis or any type of abnormalities with her spine. And we'll finish this range of motion by having you do a side bend to the right. Beautiful. Come back to center, side bend left. Come back to center, and then we'll do a twist towards my voice. Beautiful. Come back to center, a twist opposite. Come back to center. Beautiful. All right. And that concludes the spine. And then here we'll move down to the hips. So with the hips, I'm looking anteriorly and posteriorly to the hips. I'm looking especially for asymmetry of the hips and the iliac crest. I'm looking anteriorly and posteriorly here. And I do note that it is symmetrical in line with the shoulders, the glutes as well, the glute creases. And there's no asymmetry, there's no atrophy, there's no discoloration, there's no deformities, there's no nodules, no redness, no swelling that I can see here. And then what I'm going to do is I'm going to come in and palpate. So while I'm palpating is I'll palpate from the back. So she would obviously be in a gown. I know I keep saying that, but she's in a gown in a clinic, just not here. So the first thing that I would palpate here is for symmetry here, all the way around with the iliac crest here. The hip bone, and then I'm going to palpate for the anterior superior iliac crest. Come back here for the posterior superior iliac crest. And then I'm going to palpate up here for the sacral iliac joints here. And what I'm palpating for is any type of crepitus, tenderness. I'm palpating for any type of nodules, any swelling, swelling, any type of fluid, any type of heat or asymmetrical portion of the hip. And I don't feel any of this. It feels symmetrical. And that is for the hip. And then, so that was inspection. And then now we'll do the range of motion for the hip. And so for your range of motion of the hip, I'll have you hop up on the table. And so I have a pillow for her head for comfort. And then I have a pillow for the back of her knee when we get to that test. Okay, and then I just want to set the camera up for. Then you can put that one behind your head. Sorry. All right, good. All right, beautiful. And then, what do you think about it over here? Right, it's good, right? What about? Let me see your legs extended down, please. Yeah, that's good. All right, beautiful. And then I'm gonna stay in the view of the camera. I'm in the camera. I'm in the camera. I'm in the camera. I'm in the camera. Okay. I'm just gonna move these chairs over. All right, so now we're on the range of motion of the hip. And the first thing that we're going to do for the range of motion of the hip, oh, wait, we don't need this right now, the pillow. So I'll hold the pillow to the side. And then the first thing that we're going to do for the range of motion of the hip is I'm going to extend your leg up, and I'm going to externally rotate towards myself. And then, sorry, internally rotate in towards the body. And maybe I'm wrong. So it's externally rotate and internally rotate. Sorry. And then I'm gonna bring it back down. And then everything that I do, you do. Okay. So we're gonna So we're gonna lift this side internally rotate for lift, and then we're gonna internally rotate here, and then externally rotate here, right? And then extend out, and then let me see you do the same thing. Internal, external rotation. And she has full range of motion, no pain, no expressions of pain or any abnormalities. Okay, so that's the internal rotation. And then the next thing that we're going to do is we're going to do the flex test. So we're going to flex your leg up as far as comfortable for you. Is that good? All right, and then bring it back down. And then right here, I'm looking for and then flex this one up. And then bring it back down. Beautiful. This is also called the straight leg test, where I'm flexing up and then lowering back down. And I'm waiting to see if she has any grimacing, any tenderness, or any pain. There's no grimacing or tenderness or any pain. And if it were, it would be maybe an indication of lumbar disease or herniated disc of some sort. But she has full range of motion and no expressions of pain bilaterally on both sides. And then I'm going to have you go ahead and flip to your belly. Slowly. Bring my table. All right, beautiful. And then I'm going to go ahead and flex this leg up. Beautiful. And then flex this leg up. Beautiful. And then I'll have you do both sides on your own, flexing up and down, flexing up and back down. Good job. And then I'll have you flip back to your spine. Nice and slow. Take your time. There's no rush. Break my table. I'm just kidding. All right. And so here, when you come back to your belly here, dang. Okay. Sorry. Oh no, I did do the inspection. I'm like, dang, I'm touching and I didn't inspect first, but I did do the inspection there. And then I palpated. Did I say palpation? I don't know, but I'm gonna say palpation now because I don't know if I said it. But the palpation before I touched her, palpation. I was palpating for any crepitus, tenderness, any type of crepitus, tenderness, any fluid, any heat, any nodules, and any swelling is what the palpation for the hips were. I don't know if I said it, but I'm saying it now. And then here we're going to do two specialty tests. The first one is the Patrick sign, which I call in yoga a supine figure 4. So I'll externally rotate your foot and bring it across bring it across her knee on the right side. And this is the supine figure 4. And then you could apply pressure here, push down. And if it's positive, if she has pain in her sacral iliac area, which it would be positive for hip disease, but she does not have a positive sign. There's no tenderness, right? No tenderness, no feelings of pain and she has full range of motion on both sides. So let's do this on the other side. Supine figure 4. Again, I would push here for the sake of her comfort. I won't try to break her hip, but it would be positive for hip disease. Beautiful. The second test here for the hip is going to be Thomas, the Thomas sign. Thomas! Just kidding. And what I'm going to do is go ahead and bend your knee. No, bend it on the ground. Yeah, there you go. So we're going to start by bending in here. Keep this leg down and flex if you want. And then I'm going to hyperflex the knee here. I'm going to bring the knee up and extend here. What I'm looking for is if there's any type of flexion or any type of lifting on this opposite knee that would indicate a positive sign for hip disease or iliac or sacral iliac pain and tenderness and hip disease. But there is none. So I'll bring her leg back down. And then we'll do the same thing bilaterally on the other side. And we'll hyperextend up, hyperextend back, and flex the knee here. Again, feeling for any type of tenderness or pain, looking for the flexing of this knee and lifting of the knee as well, which would be a positive sign for the same thing that I mentioned on the other side. And she is not. It is normal range of motion and normal, no pain or tenderness noted at this time. Okay. So that concludes the hip series and the range of motion. I would like to move on to the knee. Are you okay staying here for the rest of it? Okay. So I'm just going to slide these up just a little bit. Is that okay? All right. So for the knees, I'm going to start by inspection on the knees. And I'm going to be, the special inspection here is where I'm looking superiorly, anteriorly, both bilateral sides, medial and lateral. I'm also looking around here for any popliteal cysts or Baker's cysts or anything like that. I'm looking for any asymmetry, both sides. I'm looking for any type of asymmetry, any atrophy, any deformities or discoloration. I'm looking for any nodules or swelling or anything like that. I don't see any of this bilaterally. There's no Baker's cyst or any signs of trauma or anything like that. Skin is intact. There's no lumps, bumps, or bruises or anything like that. Then I'm going to palpate, and I'm palpating here at the top, at the bottom, and both sides of the knee, feeling for on bilateral. I'm doing this bilaterally here and here. And then the popliteal fossa. I'm palpating for any type of crepitus, any tenderness, any type of fluid, any heat, any swelling. I'm feeling for any type of nodules or anything that's abnormal. I'm feeling back behind the popliteal fossa for any Baker's cyst or any signs of trauma, bilateral sides. And I don't feel or notate any of those at all. So now I'm going to move into the range of motion for the knee, and I'm going to bend your knee and flex you up towards your chest. Extend back down. I'm going to flex this knee and bend towards your chest. Extend back down. Does that all feel good? Now I'm going to have you show me that on each side. So flex and extend back down. Flex and extend back down. She has normal range of motion. No signs of any pain or tenderness or anything like that. In this area, there's 5 specialty tests. So we'll start with the varus, the valgus, the McBurney's or McMurray's, and then we're going to go to the Lockman's and the drawer test. So for the first test, the varus test is where you're going to put the knee on here for 20-degree lift. And what I'm going to do is I'm going to take my hand on the medial side of the knee, the outside of the malleolus, the lateral side of the malleolus, and I'm going to start by applying some pressure and seeing if there is any type of LCL, the lateral, the LCL, the LCL ligament, and see if there's any type of pain, and there's no grimaces or tenderness, correct? And then I'm going to extend her, bend and hyperflex her knee up. And I'm going to be on the outside of the malleolus and the inside of the knee. And I'm going to apply that pain again laterally. But while I apply that pain, I'm going to extend her leg down Any type of grimace or pain or tenderness would be positive for the lateral meniscus tear, and she does not have any signs of that. Furthermore, I'm going to, that is the McBurney's. So that was the varus and then the McBurney's on the way down. Next, we'll do the valgus, and that is where my hand is on the lateral side of the knee and the medial side of the malleolus. And I'm pressing in for pressure to see if there's any type of MCL ligament type of tear or pain. And I don't notice any pain or discomfort, correct? All right. And then I'll hyperextend her knee in towards her chest. And I'll do the same thing on this side, applying this pain to the MCL as well, internal rotation or external. I always get confused of these. But anyways, it's the MCL pain. And there's none here. So when I do this pain, when I do, okay, let me slow down. When I do this test, I'm going to apply the same pressure as I did at the bottom, and I'm going to extend the leg out, which will be, if there's pain or tenderness, that will be positive for the medial meniscus tear, and there is no pain. She has full range of motion, and these signs are the valgus and the varus are at 20 degrees, and they are both negative signs. The McBurney's is a negative sign as well. Then I'll go ahead and take your leg out. I'm going to do this test bilaterally. We're going to do both sides. Okay. But moving on, those 3 tests. And then the last 2 tests in this side is going to be the Lockman's and the Jor test. So for the Lockman's test, I'll place her foot here at 20 degrees. I'll go ahead and sit next to her foot, and I'm going to put one hand here on the lateral side of the femur, one hand here in the popliteal area, one here on the anterior tibial bone. And I'm going to go like a pulling and pushing in type of motion, or pull and push. I don't note any type of PCL or ACL tenderness or pain or grimace of pain, correct? All right, so that is a negative sign. And then the next one, I'm going to ask, can I sit on your foot? So for the drawer test, I'm going to sit on her foot. So go ahead and I'll sit and hold stability. I'm going to have both my hands here in the popliteal fossa. I'm going to be anteriorly on the knee, the popliteal anterior and posterior on the tibialis or the tibia bone. And I'm going to be pulling and pushing and looking for any signs of ACL or PCL type pain, grimacing, tenderness, or discomfort. Anything like that? No. Nope. And then that is a negative sign as well. And then I'm going to go ahead and extend your arms back out, or your legs back out, sorry. And I think we are done with the hips. But just please give me a moment. Let me just make sure that I did everything. I also want to note that the hips are symmetrical and the height is in alignment with her shoulders, hips, and glutes. There's no asymmetry noted, if I didn't say that. And all of those tests, those special tests I did, were in the 20-degree range, if I didn't say that. Oh, I remember there is one thing I didn't do. So when I didn't do the abduction. So I would like to lift and abduct away from the body 60 degrees. And I would like to adduct in towards the body 30 degrees. And then I'll do this on both sides, abduct away to 60 and come back in, adduction 30 degrees. And we'll place it down. And then I'll have you do that on each side on your own. Abduct away, adduct in, abduct away, adduct in. Beautiful. And you'll see that she has normal range of motion. Full range of motion with no signs of pain, tenderness, or any type of discomfort. Okay. Now I think that I am done with the hips. Okay. And then I'll have you go ahead and sit up and sit forward towards the camera, please. I'm in the camera. I'm in the camera. I am not out of the camera. I'm just going to pull my chair so I can come here. And I'm just going to clean my hands again. So we need to just see your toesies. Yeah, let's see your toes. There you go. Good job. All right. So here in the toes, we're gonna move down to the feet. We're gonna start at the ankles. And what I'm gonna do first is I'm going to inspect. I'm going to be inspecting. Is my mic on? Right. Okay. I'm going to be inspecting for any type of asymmetry. I'm going to be inspecting for atrophy, discoloration, any type of deformity, any type of deformity, nodules, redness, or swelling. I don't see any of those here. I'm also going to be looking at your toes for some bunions or callus or warts or anything like that. And I don't see any of that yet. Or, I mean, any of that at all. Okay. And then I'll start with palpation. And I'm going to palpate here, palpating around the lateral malleus, the medial malleus, bilateral side, lateral malleus, medial malleus. I'm going to palpate the Achilles tendon on both sides and the foot. Okay, the Achilles tendon, and then the heel, the callus. Ooh, the callus. Oh man, I should have some gloves or something. Okay, and then sorry, baby. Oh man, I don't do feet. Okay, so and then I don't feel any type of crepitus, any tenderness. I don't feel any type of crepitus, CTFHS. So fluid, heat, and any type of swelling or any nodules or anything of those sort. So it feels good, both sides, in here, and the Achilles back here. All right. And then we'll do the range of motion. So what I'll have you do, oh yeah, good. Well, extend your ankles up, beautiful, and then flex your ankles down. Yoo-hoo, oh, poppy so, okay. And then I'll have you rotate in a circle and then counter rotate. And she has, as you can see, she has full range of motion in her ankles, no type of tenderness, any type of pain, no other abnormalities seen at this time. And then I'll move down to your feet, looking at your toes, again, for the bunions and callus and warts or anything like that. So I'm going to be, I don't see any of that. And I'm going to be looking at your, I'm going to be looking at the asymmetry, atrophy. I'm going to be looking at any type of deformity, discoloration. I'm going to be looking at nodules, redness, or swelling. I don't see any of that. And we're looking bilaterally, so that's normal. Then I'm going to go ahead and palpate the toes. So I'm going to palpate the metatarsals of each one. And then I'm going to palpate the, I'm sorry, the pips. I knew I get these confused. The pips, the pips, the dips, and then the metatarsals and the metacarpals throughout the foot. And what I'm palpating for, any type of crepitus, tenderness, fluid, heat, nodules, swelling. Did I say redness? I don't even know if there's redness or whatever. Oh, you can't feel that. Sorry. Just kidding. I'm doing this bilaterally. As you can see, there's no tenderness or any type of abnormalities when I'm touching here. For the love of God. I ain't clean my hands because I don't do feet well. All right. So now we're going to move on to the range of motion of the toesies. So I'm going to have you flex your toes down to the floor. Beautiful. Extend your toes up towards your nose. Nice. And then right here, I'm going to have you evert your toes in. Yes. And evert your toes out. Good job. No type of pain or swelling or no abnormalities, no type of tenderness or anything like that. All right. So I think I am done with my head to toe of the musculoskeletal, but just please give me a moment just to see if that's it, which I do think it is. There's no discoloration. Okay. Oh, excuse me. I forgot when I palpated here for the plantar, we did plantar. There's no signs of plantar fasciitis or any type of tenderness on either foot at all. Okay. And I think that's it. Ooh, I don't know. Okay. Okay, I think that's it. I thought I forgot something with your head and neck, but I'm hoping that I did not. We did all the range of motions of every body part, and I think we are done. All right, we're done. Thank you for watching.